Okay, so my name is Nicole Weiss. I'm currently a T32 postdoctoral fellow at Yale University, and I'm really excited to be sharing the results of a study my colleagues and I have recently completed that explores the roles of negative and positive emotion-driven impulsivity in BPD symptoms and HIV risk behaviors. Before I begin, I just want to acknowledge the funding sources for this project. So the primary project from which the data were drawn was supported by an R21 awarded to Dr. Matthew Tull, and my work on the project was supported by a T32. So Alice, all of us in this room are well aware, BPD is defined by heightened engagement in a wide range of risky or impulsive behaviors. And today I'll be talking specifically about HIV risk behaviors. There's actually been fairly limited research on the relationship between BPD and HIV risk behaviors, but that research that has been done suggests that individuals with BPD are more likely to report more risky sexual partners, such as casual partners, as well as more condomless sex with such partners. For this reason, it's really important for us to identify factors that may moderate the relationship between BPD symptoms and HIV risk behaviors. And so emotion dysfunction may be one such factor. We know that individuals with BPD display heightened levels of emotion dysfunction. We know that emotion dysfunction contributes to HIV risk behaviors. And we also know that emotion dysfunction helps to account for the relationship between other forms of psychopathology, such as PTSD symptoms and HIV risk behavior. So the primary aim of this study was to better understand whether emotion-driven impulsivity may help us to better identify women with BPD at risk for engaging in HIV risk behaviors. An important limitation the study also sought to address was that regarding the roles of negative versus positive emotion dysfunction in these relationships. So most of the research to date has focused almost exclusively on emotion dysfunction stemming from negative emotions. However, there's been growing research to suggest that individuals may exhibit emotion dysfunction in response to positive emotional experiences, and that there may be negative consequences associated with such emotion dysfunction. Among individuals with BPD, we know that they tend to be non-accepting of positive emotional experiences, so they may find them frightening, for example. We also know that individuals with BPD are more likely to report heightened levels of positive urgency or a tendency to engage in risky behaviors in the context of positive affect. And finally, there's been growing research on the role of positive emotion dysfunction and positive urgency in particular in HIV risk behaviors. So as I stated earlier, the goal of today's talk will be briefly review a study that explored the moderating roles of negative and positive emotion dysfunction and the relationship between BPD symptoms and HIV risk behaviors. For the larger study, the eligibility criteria were that the participants had a current diagnosis of alcohol or cocaine dependence, as well as no cognitive deficits or psychotic disorder. For the current study, we used the DIPD-4 to assess BPD symptoms, the risky behavior questionnaire to assess negative and positive emotion-driven impulsivity, and the TCU to assess past 30-day HIV risk behaviors. The final sample was comprised of 176 individuals with a substance use disorder. About half of them were female. The average age was 34. It was a fairly diverse sample, and not surprisingly, given the focus of the study on a substance use sample, we see relatively low levels of income, education, and employment. Just regarding some preliminary analyses, about a third of the sample met diagnostic criteria for BPD. And among those individuals with BPD, about three-quarters of them reported engaging in at least one HIV risk behavior in the month prior to entering treatment. Regarding the zero-order correlations among the study variables, surprisingly, we didn't see a relationship between BPD symptoms and HIV risk behaviors. However, all of the other primary study variables were significantly positively related. So what we did then is look at two models to explore the moderating roles of negative and positive emotion-driven impulsivity in the relationship between BPD symptoms and HIV risk behaviors. I'm just going to describe those findings simultaneously. So looking at the main effect of BPD symptoms, not surprising given our zero-order correlations, there was no significant main effect for BPD symptoms. We did see a significant main effect for emotion-driven impulsivity stemming from negative emotions. And there was a significant interaction effect for the relationship between BPD symptoms and positive emotion-driven impulsivity in predicting HIV risk behaviors. And what that looked like is this. So we can see for individuals with lower levels of BPD symptoms that really positive emotion-driven impulsivity doesn't really contribute much to their engagement in HIV risk behaviors. However, for those individuals with high levels of BPD symptoms and high positive emotion-driven impulsivity, we see that they are much greater risk for engaging in HIV risk behaviors in the past 30 days. And so I think these findings just provide some preliminary evidence for the potential role of positive emotion-driven impulsivity in HIV risk behaviors. Okay. I was almost there. Okay. Thank you.
Yeah, thank you. Thank you.